welcome to Hatching for Health with your host, Jessica Hatch. Tonight's episode, we are going to be joined by Dr. Nicole Shutko, who is a chiropractor from the Houston area. Now, she has a wonderful practice. It's right over in the Heights. I personally get treated by her, so I have wonderful things to say, of course. But first, I did want to announce our giveaway winner. So we did it for a shirt this week, and it's from findyourrare.com. These are fabulous shirts that are provided anywhere you want to buy them from on their website, and Whitney Lavender was our winner. So congrats, Whitney. We will get your address and get that shipped out to you. So now let's introduce our guest, Nicole Shutko. Thank you for being here.
Thanks for having me.
Yeah, I've known you for quite a few years now, and I'm now actually a patient of yours, which brought us back together. Yes. So tell us a little bit. So you're located pretty central right here in Houston. Yeah. It's off of 610.
And East TC Jester. So like Garden Oaks, Oak Forest, and the Heights.
Okay. And you've been practicing for how long?
Over 20 years.
Really?
Yeah.
Baby face.
Yeah. Thank you.
That's amazing. Yeah. And you, right here in Texas, so you went to University of Texas in Austin?
In Austin. Mm-hmm.
Okay. And then where did you go for chiropractic?
I went to Parker Chiropractic University in Dallas.
Okay.
So, yeah.
Very good. And so when you were in college, did you know that that's the direction you wanted to go? No.
I wanted to be a veterinarian.
Oh, really?
So, yeah. I got a biology degree, and then I applied to A&M vet school. And I had an interview with A&M and almost got in and didn't get in, and then I started teaching middle school here. Sharpstown Middle School for 2 years.
So your degree, your bachelor's degree was actually what exactly from?
Biology.
So it was biology,
yeah.
Okay. And that was where you were, kind of wanting to go the veterinarian route?
Yeah.
Okay.
Yeah.
I can see
Thank
that.
God I did not get in. Because
really?
I wouldn't have been happy.
Really?
Yeah.
Yeah, I mean, being a chiropractor, I mean, you see so many unique situations from, people just, wanting that, lifestyle of the alignment to, extreme pain. And you guys don't just, adjust the back. I mean, tell us a little bit about from A to Z what all y'all do in your practice.
Well, lately I've been seeing a lot of vertigo patients. So people who've been going everywhere, not getting any help, no relief. And so I've been treating I came up with my own protocol, and I've been seeing a lot of that.
And vertigo, to my knowledge, it's where, you're constantly feeling like a dizzy spell, right?
Yeah, like you can't stand. Like a lot of them have to have help. Like I had a patient she had to have help just getting to the bathroom for 2 years before she came to see me.
Really?
Yeah. So like at night, it's really dangerous because, if you have to get up in the middle of the night, get out of bed, and you can fall and hurt yourself. And,
of course.
Yeah.
So there's a protocol you've come up with specific to them, and what does that look like?
So we get x-rays, and usually there's something wrong in the neck.
Okay.
Usually. And I do class 4 laser on the scalp and in the back of the head, and we do decompression, and I adjust with a computerized adjusting instrument called the Pro Adjuster. And then I do a headache protocol where I'm actually adjusting the skull.
Really?
Yeah.
And
that's been really super successful. I'm having people drive from San Antonio, from 2 hours away, 3 hours away, because they found out,
that you're doing that.
Yeah.
And how many treatments does it take to kind of start to see a difference?
It depends with everybody, but usually in like 4 to 6 visits, people are getting noticeable results.
Really?
Yeah.
And then is it something they have to keep up with, or is
kind of like maybe monthly just to get an adjustment. Yeah.
Okay. But it's
or decompress the neck with decompression therapy.
Okay.
Yeah.
So with chiropractic school, is that a 1 year, 2 year? How many years is that?
It's basically a 4-year post grad. So you get your doctorate.
Okay.
So you go. We went when I was in school. It was 3 years and almost 3 years and 2/3.
Okay.
Yeah.
Okay.
But you go 3 trimesters. Like there's no breaks. You don't
really
stop. Yeah.
Yeah.
And you take 37 hours. I mean, it's a lot.
That is
33 hours.
And you went straight, so you pretty much didn't take a break.
So I graduated undergrad, and then I taught school for 2 years, and then I applied.
So you did take
started,
that.
yeah.
Okay.
So I started when I was
teaching middle school, was that something, animals, children, was it just kind of an area?
I always wanted to teach because I thought I'd be good at it.
Yeah.
you know?
And you probably were, but
And
you're like...
I was.
"There's
I
something-"
loved the kids. I just didn't like all the administration part.
Okay.
Yeah.
Yeah.
And
with
I didn't like being able to not leave campus, you know, to go lunch
Yeah.
and stuff. No.
It's like as a teacher, it's like, yeah, you don't have the front desk, the back office, like as you do as a doctor, you know, you're running the show, but you have a lot of hands around you.
True.
Handling the part that you don't want to handle. You just, the hands-on with the patients is where, what you're good at. So keep it to that, right?
Thank you. Yeah.
So with Hatching for Health, one of the things that we do a lot of is have children on that have been diagnosed with rare conditions and not so rare conditions. Children that were just born with things that are maybe more common and more familiar, and a lot of their treatment that they're having to undergo is a variety of different doctors. So I wanted to kind of know a little bit about that area, because I know that I saw you had a baby in there you were adjusting.
I adjusted a 2.5-week-old baby last week. He wasn't latching onto the mother. So usually after an adjustment, they'll immediately start latching. Like after...
Really?
Yeah, within minutes sometimes.
I
know, I just got chills telling you that.
Yeah, I mean,
literally.
I personally have a family member that the baby was not latching, and for those that are watching, that's related to like you give birth and you're trying to breastfeed the baby and they're not wanting to latch onto the mother's breast to be fed, and a lot of mothers, that's the way that they bond. I mean, some opt to bottle feed and do other options, but for those that want that bond, that vitamins that they get, it's to not have that, it's got to be...
And it's just good for the babies to form the mouth and everything.
But for a mother to not have that, it must be, obviously...
And they feel like a failure.
Yeah, like, what did I do? I just carried this baby and now they don't want to, So then they just... I guess there's word and they find you, because, I mean, this lady, for example, how did she know?
She was actually... I see a ton of pregnant women in my office.
Really?
Yeah, my practice is really very much a lot of prenatal women.
Okay.
Yeah, so I kind of started to have a niche with that, and then their babies are born, and then they have a problem and bring the baby to me. That's usually how it happens.
So you take a few-month-old baby and you actually do a little adjustment of its spine, and
so usually they need to fix their gut. So I see a lot of babies like with tongue tie, like that, and then with an adjustment that will go away.
Okay.
And a lot of people are getting surgeries for that when they could just get a simple adjustment. It's a lot cheaper and a lot easier on the baby.
Yeah.
And I see a lot of babies with colic, babies, a lot of ear infections for toddlers and infants, like 2-year-olds or 11-month-olds. Yeah. And so what I do is I adjust them, and then we also fix the gut, because usually the gut is passed on from the mom.
Okay.
And so if the mom didn't have a good gut, because usually like after we're 30, we start to have less enzymes. We may not have good bacteria. So we need good probiotics and a good digestive enzyme, and I'll put the baby on that, and then the baby will get a lot better quicker.
Oh, really?
Yeah.
Okay, because then the
colic will
breastfeeding,
go
so they're
away.
getting all of the nutrients the mother's,
Yeah, so the mother is passing on her bad gut a lot of the time.
Okay.
Yeah.
And so
we need to fix the baby's gut.
Okay. And is that, I guess, different probiotics that you guys have there in the clinic that you offer? Okay, so combined with...
So the baby needs a digestive enzyme to break down the food, and then the probiotic to get rid of the...
Okay.
Yeah.
And then, so that's, and
that helps with ear infections, colic, a ton of things.
So many things.
Yeah.
Who would know?
I know.
That's incredible.
And pediatric medical doctors don't usually suggest that, so
don't always connect that for the children. And so then from that age, because a lot of that's tied to, like you're saying, like to what the mother's eating, but just as 4 or 5, like as they get older, do you tend to see them as well for adjustments? Is that common?
Usually, well, sometimes I'll see some 2 to 4-year-olds, but mainly I've been seeing a lot more like 8 to 10 to 12 when they start getting on those video games all the time and looking down a lot, and their posture's really bad, and they're getting headaches or even back and neck pain now.
Really, at that age, and that's something
it's a lot more common now than it used to be when I first started.
I bet,
because we're always on the computer.
Whether it's video game or just in general electronics.
the
you
cell phone. Yeah.
Yeah, I can imagine.
TextNet.
Yeah. So with your practice, you could be an adult, a baby, a middle-aged child.
From the womb to the tomb.
Yeah, there you go. There you go.
Yeah.
So, and I think, I have to bring it up because my dogs, they're both lab mixes. Yeah. So I was, speaking with one of our mutual friends, and I was like, my dog Dolce has just got some kind of, issues with her spine. Like you touch her neck and she's like jumping and crying.
How is she, by the way?
So she's doing much better. Good. Yeah. So we need her going for her second adjustment. Yeah. So we brought her to you, and I brought my other dog along.
That was hilarious.
And you actually adjust dog spines. And tell us about that.
Okay. So this is how I got started. I was a vet tech at UT because you had to have experience to get into vet school.
Okay.
And so I have a lot of experience with animals.
Yeah.
And I love them, especially dogs and cats. And then when I went to chiropractic college, the dean of basic sciences was our anatomy professor, and he was also a veterinarian, and he had a veterinarian clinic across the street.
Oh,
and
cool.
so I worked for him, and he adjusted the animals. So I learned how to adjust from him.
Yes.
And then I've actually taken another,
course on it.
Yeah.
Yeah. Yeah, and so you use that same machine that you can use on us humans.
Right, the arthrostem.
Yeah, and it like, it's kind of like a really intense vibration, a really strong, powerful tool. But
it actually moves the bone.
Yeah.
It moves the bone.
Yeah, because you were following down her spine, and then you're like, look right here, and then you did it, and it's like lined it.
Yeah.
It's amazing. So we do have to take a commercial break, but how interesting is that? You can not only go yourself, you can bring your animals. I mean, you do need an appointment with those animals, though. But you always need an appointment. Yeah. But we will be right back here with Dr. Shutko after the break. It's time for Hatching for Health's giveaway. This week we are going to be giving away this special lip gloss, Blaine Beauty. I'm actually wearing it this evening. It is one of my favorites. It gives just the right touch. So what's special about this lip gloss, and not only this product, but the other products that Blaine Ochoa sells on her website, blainebeauty.com, is that 10% of the sales actually help child international relief efforts, as well as ending child hunger, and helps with education initiatives in other countries as well as here. So she's doing wonderful things, not only selling these beautiful products, but also giving back to children. So I'd like to buy one and give it to one of you. So if you will put your name below or nominate somebody, we will be announcing the winner on next week's episode. Imagine hearing the news as a parent that your child has been diagnosed with a condition that is degenerative or life-threatening. Now imagine being told that there's little to no research for the condition that even exists, making it difficult to try and figure out what to do next. The reality is that for so many rare conditions, finding specialists who understand the condition and being able to make informed treatment decisions for their child is very challenging. Each episode, I will help with my network of physicians and medical resources across the U.S. to attempt to connect the dots by bringing widespread recognition of rare conditions and connecting families to the best treatment, clinical experts, resources, and support. I'm going to highlight these hard-to-diagnose diseases and offer in-depth awareness for families of children in the rare disease community. I believe we are all in charge of our own healthcare, and pushing for answers and creating awareness for these various rare health conditions can make the world around us a better place. Not only am I a huge advocate who seeks to spearhead the fight to bring rare conditions to the forefront of research, but I personally had my own rare condition. In this rare condition, I was able to be cured of due to early detection. My passion to help others was fueled by that experience, and it has led me to start the Hatching for Health show. Now, this show is a vehicle for us to create awareness to help these children find cures. Hi, I'm Jessica Hatch, the host of Hatching for Health. We are a show that was brought about to create awareness for children with rare diseases, disabilities, and disorders with hopes of finding cures. We're looking for doctors that would like to participate in being on our episodes and possibly even bring their own patients on the show to talk about how they have helped cure them, whether it's been surgically or through medication, or any sorts of ways. We think that it's very inspiring for others to learn these stories and to possibly help somebody else. So I encourage you to reach out if you are a doctor who is interested in being on the show and allowing us to highlight not only you, but the work that you've done for a child. You can reach out by emailing at info@hatchingforhealth.org. That's info@hatchingforhealth.org, and we look forward to hearing from you. Welcome back to Hatching for Health. In case you just joined us, we have Dr. Nicole Shutko here. She's a chiropractor in the Houston area, and we are just chatting it up. So we're back. We were talking about all the various people and animals that you treat before the break, which is fantastic to know for me and everyone out there. But tell us a little bit about like some of your, work outside of your practice. I mean, what's something that somebody wouldn't know about you?
Oh gosh, they wouldn't know about me.
So I read some stuff on your website about actually a pretty famous show that's on television, and when they were touring through Houston.
Oh, so you think you could dance?
Yes.
So I used to be the chiropractor for them when they were touring.
Okay.
I would go and adjust them, and it was pretty cool.
Really?
Yeah.
So they were, I guess, kind of here,
So they do the tour after they win, like the whole group does the tour.
Okay.
Yeah.
How did that get connected? Like, what was the relationship
I don't
there?
know. I can't remember how I got found.
Yeah.
I think it was a referral from another chiropractor.
Really?
Yeah.
Okay.
In another city, yeah.
And you also you've treated like opera singers, athletes.
Yeah. Some ex-NFL football players, which by the way, they don't want to pay.
Yeah.
They think everything should be free.
Yeah, really.
I know.
They're like, I'm here.
Bless their heart. I've done some Rice College football players.
Okay.
Some Houston ballerinas.
Yeah, a lot of our, local Houstonians here. I guess all of this is just related to the spine predominantly, but like with an opera singer, is there concerns with their vocal cords that are related at all?
Usually not, no.
Okay, I didn't know if, I know sometimes
they have a lot of neck and back pain too.
Yeah.
So, yeah.
I know. Don't we all?
Like we all do, right.
Yeah. What are some of the things that, we can do to maybe avoid some neck and back injuries that seem to be more common?
Well, you need to sleep on your back, with some pillows underneath your legs.
Okay.
And with your head almost touching the mattress. So a lot of people sleep with their head like that.
With a
but
really
we've got too much head forward.
Okay.
And like we're always looking down, text neck. We're sitting a lot causes that. Sitting a lot is bad for the back. Sitting a lot is bad for the neck.
Really?
Head forward. Yeah. So trying to not sit all day.
Okay.
Sit and stand desk.
I have one of those
super helpful.
from Costco, the electric one.
Yeah.
They're only $250 from Costco.
And then IKEA has a cheap one too.
Really?
Yeah, and that doesn't take up that much space. You just put it on top of your desk.
Okay, yeah. This one, the entire desk elevates up and down.
That's really cool.
And we have it for the doctors coming through the clinic, and they can just throw their laptop on it. If they need to sit, they can lower it.
That's really
but
cool.
It is very convenient, because just with sitting it's not really my thing and the nature of what I do, but
either.
I will.
Thank goodness.
I'll end up, sitting there for a little bit, and I just, you almost start to feel out of a line.
Another thing about sitting is, when you're sitting, your legs should not be parallel to the ground. They should be elevated a little bit, and that really helps the back.
Oh, interesting.
Yeah.
So for those that do have desk jobs.
And your legs should definitely not be like this. That's like super bad for the low back.
Like in hills, you mean?
No, your legs, like, if you're sitting in a chair, the chair, your legs shouldn't be dangling down.
Oh, okay.
Because I'm really short, so I'm always like this. So I have to find something to prop my feet up.
Okay.
So that my legs are at an angle.
Okay, and that just
a
also
little
helps
bit.
with the spine.
Yeah, and then it also helps just put you in a good position in your posture.
Okay, yeah, that makes a lot of sense. With children that come to you, you were saying, I mean, are there anything like sports related that
A lot.
are, they're coming in
With kids? Yeah, I mean, I've had some baseball players and some soccer players, but I
Okay.
get a lot of scoliosis too.
Oh, do you really?
Yeah.
A girlfriend of mine has that.
Yeah, and you have to get x-rays to know if you have scoliosis or not. Like that school check does not work. Yeah.
Really? So scoliosis is something that you were born with, or is it
No,
developed?
so a lot of times like when they grow, too quickly.
Okay. So
I
you
think,
wouldn't be born.
But we don't really know exactly what the cause is.
Really?
You can be born with like if your bones are misshaped, okay, and like one's like not square, it's like more, at an angle, that can cause a scoliosis. So that can be from birth.
Oh, really?
Congenital, but most of the time it's not.
And if someone, has identified they do have it through x-rays and, proper diagnosis, like what's the best way to treat that? Is it
Through adjustments. 'Cause
Really?
you can actually move the curve,
really? And is there certain like activities that they have to avoid, or is it normal?
No, but
Working
there's certain
out.
stretches and strengthening. You've got to strengthen the spine, and there's certain things they can lay on the ball, on the side of the ball to help
Okay.
decrease,
Do y'all do those
decrease the
things
curve.
there?
Yeah, we teach all
Okay.
that.
Yeah, 'cause you have-
I do rehab as
Yeah,
well.
there's an entire, like gym in
Yeah.
your place. You walk in and
Yeah.
there's the adjustment rooms, but you have,
And I have a rehab specialist that,
okay.
that helps with that.
Yeah, the machine.
Brandon.
Okay, yeah, and the machine that people stand on, it has like a,
The Vibe.
yeah.
The Vibe is super awesome.
What is that doing for?
So it decreases inflammation in the whole body.
Okay.
But it retrains the tiny little postural muscles in your spine. It helps to hold the adjustment, but it decreases cortisol in your body. So that's the stress, the bad
I need
stress
to come do
hormone.
that, yeah.
And that breaks down muscle and builds fat. So you don't want that. It also increases growth hormone, which is your anti-aging.
Okay.
It decreases osteoporosis. It helps decrease the curvatures. Like if you have some scoliosis, it helps decrease that. It does a lot of things. But for me, it's mainly to decrease the inflammation and decrease the bad stress hormones, so that but your body cannot heal if you're stressed. So if you're stressed and when you're stressed or you're in a lot of pain, you produce a lot of cortisol, and cortisol is going to break down muscle. It doesn't help.
Really?
Also, cortisol decreases the production of melatonin, and you don't sleep well. That's why when you're stressed, people don't sleep well, because cortisol breaks down the melatonin, which we need to fall asleep.
Sounds, like going through
Yeah,
now.
which everybody
okay,
is.
you
like,
just answered
any
4 of
kind
my 5
stress,
questions.
Right, yeah.
Yeah, no, it's
So
something.
when you're in pain, you produce a lot of cortisol, and that's why you need to do something about your pain. Because if you can't sleep, you can't repair.
Of course. So for the everyday individual that, it feels fine and healthy, maybe they have some, typical stress in life, but, would you recommend them coming to a chiropractor?
So this is, of course, because how would you know if you had cancer? You go get a mammogram or you go get a test.
Yes.
How would you know if you had high blood pressure? You take your blood pressure. How would you know if you had high cholesterol or diabetes? You don't have pain, right, from any of those.
Right.
Most of the time you don't have any pain unless you're in a really progressed state of a disease, like a cavity. You don't. How would you know if you had a cavity? You have to go get checked. So if you don't know if your spine's out of alignment, because just because your spine's out of alignment doesn't mean it's going to cause pain. It's causing damage and problems.
Yeah.
But it may be symptoms that you're unaware of, like maybe you're not digesting your food well,
and it could all be tied to not,
The
having
spine.
proper alignment. So really, someone, should come and
just go get checked.
get checked, and then
And
from,
you really want somebody who's going to do some x-rays, because you really don't know the condition unless you do some x-rays.
Correct.
And you can't really make a true diagnosis without the whole picture. So you want the exam and some diagnostic tests.
and then
I
do know. And then at that point, kind of say you figured out that there are some underlying issues that now you're able to correct because you came to the chiropractor. From that point forward, is it good to come once or twice a month? Like, what's kind of
It
a
just
good
depends
routine?
on how, like, so usually after somebody's gone through a plan and we've kind of gotten to the point where they're as good as we're going to get them, then you really do have to maintain it. Because if you sit a lot, if you're on the phone a lot, or if you're on the computer texting all the time, your spine's going to get out of alignment.
Okay.
You know?
Yeah.
Or if you do something like, if you're a heavy golfer, like your spine's not going to stay in alignment.
Yeah.
You don't
You're
keep
gonna need to be-
alignments.
yeah.
You know, we're not static. We're always, changing.
Yeah.
You know?
No, absolutely. Well, I also just, in your work, like, is there certain things that you've seen, I guess you've been able to influence others, with just overall better health and well-being? I mean, I think in a way, I think of chiropractors as like, someone that you build such a rapport with, you go to a lot more often, I would say, than most doctors. And you probably, hear a little bit of everything in one story, but I guess just, as a doctor, like, how do you feel you've been able to influence, some of your patients?
I mean, well, I've influenced some of my patients. I'm a heavy meditator, so a lot of my influence has been sometimes not even about chiropractic, but about just helping other people reach their true potential.
I think that's beautiful. Yeah, the ambiance in your practice speaks to that. Like,
I just got chills.
The tone, the just the lighting. I think everything about it. When I come in there, I feel at peace.
Yeah.
And so I think I don't see why anyone wouldn't feel that same way.
Yeah.
So I think that's great to know, and I need to get more on the meditating side. I'll have to talk to you about that.
Heart and brain together,
Mm-hmm.
and that helps your health too.
Yeah, absolutely.
Yeah.
Well, so if someone wants to make an appointment, where can they find you?
So my website.
Okay.
I'm also on ZocDoc, but
Okay.
femalechiropractorhouston.com.
Femalechiropractorhouston.com.
Chiropractor Houston.
Okay.
Femalechiropractorhouston.com.
Femalechiropractorhouston.com. Wonderful.
And then you can schedule online or call.
Okay.
And if you have insurance, we'll check it for you before
Okay.
you come in, so you know what it
fantastic.
covers.
Awesome. Well, if you would like to see and meet Dr. Nicole Shutko, you can go to their website, The Female Chiropractor.
No, Female Chiropractor
Just female.
Houston.
Okay.
Yeah.
So femalechiropractorhouston.com. No, it's perfect though. That's what she is. Exactly that. And you can make an appointment right there, or look her up on social media or ZocDoc. So thank you so much
Thank
for
you
being
for
here.
having me.
It was wonderful having you.
appreciate
and thank
it.
you all for tuning in. We will be right back here with you next Tuesday at 7:30.